Hello, everybody. My name is Dr. Alisha, and I am Dr. Alisha of Empower Health Coaching. I'm here today to review one of the most frequently asked questions that I get asked in the clinic about prenatal vitamins. But before I do that, just to tell you a little bit about what I do, I am a women's health coach, and I help women in their 30s and beyond to prepare their bodies, minds, and spirits for pregnancy. I offer a course which helps women to do exactly that, to really give step-by-step guidance on how to prepare in the event that you're looking to really up the ante, do what it is you need to do to get healthy, to change your lifestyle, to change your diet, as best you can before kind of seeking medical attention for any issues that you might be having getting pregnant. In addition to helping women get pregnant, I help women with a whole range of issues, including issues with heavy periods, gas, digestion, bloating, weight loss, absolutely anything. So if you have any questions or feel like you need some assistance with meeting your health goals, please just be sure to DM me and I'll get right back to you and let you know if it's something I can help you with, which I'm sure I can. So let's just jump right into it. So we are going to talk today about prenatal vitamins and how to choose them. So there's really two major things that you need to consider when you're choosing a prenatal vitamin. One is the formulation, right? Because many prenatal vitamins are formulated different ways. Some vitamins are formulated as tablets, which you can, swallow, but they kind of have that chalky feel to them. Some people don't really like the taste, that chalky taste that they get when they're swallowing the prenatal. It can also be formulated as a capsule, which is where the vitamins and nutrients are contained inside of a coated capsule, which is much easier to swallow. And also there's the gummies, which are most people's favorite in that they can just chew them like candy. Oftentimes with the gummies, you have to take several at once. But there are pros and cons to every type of formulation. So you just want to make sure that you're choosing one that has the right nutrients for you. In terms of the gummies, they often don't contain iron, so you just want to make sure that if you are somebody who's iron deficient or has a history of anemia in the past, that you're choosing a vitamin a gummy that does have iron. As I mentioned with the capsule, it doesn't really have as many drawbacks, so you just want to check the nutrients. The tablets also sometimes can be chalky, which people don't like. Also, if you're getting a vitamin that's covered by insurance, your insurance may dictate which formulation you will get. So you may want to buy one over the counter if you don't like it. The other important thing to remember with the formulation is that some of them can cause stomach upset, a little bit of nausea or abdominal pain, particularly if you're taking them on an empty stomach. So not all prenatals are created the same. So it's really good to just try different brands if you've tried a brand that doesn't agree with you. Okay, but I highly recommend taking a prenatal vitamin starting at least 3 months before you're planning to get pregnant. If you have more time than 3 months, by all means, please do start your vitamin before that. The longer the better. Prenatal vitamins are also really good for women in that they help with hair growth and nail growth. If you have any other pre-existing vitamin deficiencies, it can really help with that too. So I always, recommend a prenatal vitamin also if women have other issues that, may require vitamin supplementation. Okay, so we'll get right into it. So how do I choose a prenatal? So one is the formulation, so you want to consider that. And then the second issue that you want to consider is the micronutrients or the nutrients inside of the vitamin, right? So most prenatal vitamins, the formulations are pretty similar in terms of the types of micronutrients they contain. However, they may vary in the concentrations of these nutrients that they contain. So you definitely want to make sure you're turning that bottle over, you're looking at the nutrients on the nutrition label to ensure that it's a good fit for you. If you're really not sure how to choose, you can always talk to your doctor and you can speak specifically about what medical conditions you have and if there's specific nutrients that you may need more of. But in general, you definitely want to look for iron in your prenatal vitamin. As I mentioned, many gummies do not contain iron. So if you're looking to get a prenatal gummy, you just want to make sure that it does contain iron. If you're somebody who's not anemic right now, you may not need iron supplementation, but if you are, it's a good idea to ensure that your iron stores are, very high, so that when you do get pregnant, you don't develop anemia early on in your pregnancy. Okay, so usually with tablets and also with capsules, you will definitely get iron in those vitamins. Okay, iron is also contained in natural sources as well. You could find iron in plant-based sources such as beans, legumes. You can also find iron in animal-based products as well, so meat, chicken, that kind of thing as well. Okay. Other nutrients that you want to consider are vitamin D. So most prenatal vitamins do contain vitamin D. The recommendation is 400 to 600 units per day of vitamin D. However, I recommend really supplementing with more than that. You may want to get a vitamin D capsule specifically, a gel or capsule that you can take where you can get 1 to 2,000 units of vitamin D daily. And the reason why I recommend that is because vitamin D is very, very important for the skeletal health and bone mineralization of the baby, but also of yourself. Vitamin D is also a hormone. It's been linked to mood regulation as well. So you just want to make sure that you're getting sufficient amounts of vitamin D, either through the vitamin or you can also get out in the sun. I know we're living in the era of COVID-19, so it's really, it's best to stay in your home, but you can also get some sun if it's sunny by standing near a window for at least 15 minutes. You can get outside and walk, but just make sure that you do maintain the rules of social distancing so that you're not too close to people. You want to make sure that obviously your face is exposed, and if you can do arms as well, that's good, just to get some skin exposed so that you can also boost up your levels of vitamin D. Vitamin D is also found in some types of foods as well. So you can also look to see which foods might be fortified with vitamin D. Certain types of cereals, milks also contain vitamin D as well. So that's something that you can look for. In addition to that, there are some vitamin D rich foods, which include mackerel, salmon, certain types of mushrooms as well. And as I mentioned, cereals and milks that are fortified. So you can look for that as well. Another major nutrient that you want to look for is choline. Most, I would say, really very few prenatal vitamins contain choline, but choline is a very important nutrient for the brain development of the baby. So you want to make sure that you're at least getting sufficient amounts in your diet. Eggs contain very, very high amounts of choline. But you can also get choline from plant-based sources as well, including chickpeas, mushrooms, soybeans, broccoli, quinoa, and kidney beans. So those are some sources if you're not really, if you are a vegetarian or a vegan and you're looking to kind of get more choline, you can, consider eating those foods in higher quantities as well. Choline, it's really important to kind of really start being intentional about eating it because studies show that about 10% of pregnant women are deficient in choline. So you want to make sure that before you get pregnant that you are at your most healthiest and that you have the stores of vitamins and nutrients that you need. The other major thing I would look for in the prenatal vitamin is the omega-3 fatty acid, particularly the DHA. DHA is essential for proper brain growth and eye development in babies. So this is something else that is super important to try to get in your diet. You may not find it in a prenatal vitamin. You may have to supplement either being intentional about the diet or by taking a fish oil supplement as well. Just be careful with choosing the fish oil supplements and ensure that it's a reputable company that you're choosing because there has been a lot of controversy around the quality of certain types of fatty acids that are on the market. So you just want to be sure of that. You can find DHA in fatty fish, in algae, in eggs. It's also in certain types of foods that are fortified as well. Other types of omega-3s in like ALA and walnuts, flaxseed, chia, edamame, these things as well. And also winter squash. So you can definitely consider that. Okay. And the last thing is folic acid, which I'm sure you all know much about because it's something that's a very popular vitamin. Folate is essential for brain, spinal cord, and spine development in the baby. We usually recommend about 1 milligram daily, and most prenatal vitamins do contain it. So you don't have to worry so much about that. In the event that you are looking to try to, get folate in your diet, you can certainly do that too. The one thing I should say about folate is that you want to make sure that you're choosing a vitamin that has the methylated form, and it's called L-methylfolate. And the reason why I say that is because most prenatal vitamins contain a form of folate that is not readily bioavailable or available for your body to utilize. So if you choose a formulation of a vitamin that contains L-methylfolate, you're likely choosing a vitamin that has the active form. The reason why I say that is because 40% of individuals worldwide have a deficiency in this particular type of enzyme that can convert the lower bioavailable form to the higher. So you just want to make sure you're getting that as well. Okay, so that kind of wraps up my 411 talk on prenatal vitamins. You can all feel free to ask me any questions. You can DM me. I have course offerings if you want to learn more about how you can prepare your body for pregnancy. I'm offering a 6-week course. It's virtual for women of all ages, although the course is really targeted towards women over 30 and how best they can prepare. All right, I think that's it. I wish you all a wonderful Saturday. Stay home, stay safe, and hug your loved ones often. Have a wonderful day.